This next segment is brought to you with the compliments of MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Pleasant good morning to all of you listeners here with us on Q100.7 CBC Radio for another episode of the Pulse Radio Show. It's always great to be with you. I'm Shane Seeley, Communications Specialist with the Queen Elizabeth Hospital. And as you know, the Pulse Radio Show is a production of the Queen Elizabeth Hospital in collaboration with our partners, the Caribbean Broadcasting Corporation. As I said, always great to be in company with you. And I gotta say, a pleasant welcome back to my co-host, the Chief Operations Officer of the QEH, Dr. Christine Greenidge. She had a lot of rest. She had some relaxation, as far as I understand. And she's here in her lavender. That's what you call it. They say men don't know colors.
Purple.
This is purple.
Purple.
All right.
Mauve.
Mauve. All right. She's here in her purple. And of course, we have all of the information you need as we continue to educate the public on the 2025 to 2028 strategy. Along for the ride today is our Director of Nursing Services, Henderson Pinder. Many of you CBC fans would have met him recently as he had an appearance on the People's Business last week to talk about the strategy and nursing's involvement, and that's why we decided to bring it here to the Pulse Radio Show as well. So welcome, Mr. Pinder. How are you doing this morning?
I am well, thank you very much, Shane.
Yes, Mr. Pinder and the COO were very busy yesterday. I was a bit busy as well, as we always do respond to the needs of the public. This time around, a message was circulating among our staff, and we had to investigate what was an unauthorized message on temporary shutdowns of shifts at the QEH. It went out and it really got us into action, because then we had to do some juggling, some responding, but it went pretty well. We were able to cover many of the bases that were left uncovered.
Absolutely, and this was an event that happened yesterday at our beloved Queen Elizabeth Hospital, and upon learning of the actions where throughout various departments we did not have the complement of staff on hand to care for our patients, our leadership team led by Mr. Neil Clark, our CEO, myself and the other directors got into action to make sure that we did not compromise the patient safety and the wellness of our patients, and of course our staff who came to work as well to make sure that we supplemented with additional help to make sure that we did not put our patients at jeopardy.
Yes. Of course, this issue surrounded COVID hazard payments. Plans have been set up to meet with the union to see how we can go forward in addressing some of these concerns that some staff may have had. On the nursing side of things, our nurses would have been the ones, they're the majority body that make up our staff complement at the QEH, and they were definitely called into action in the accident and emergency department. And it was good to hear that this morning only two patients were waiting for a few hours to receive treatment. So that was some good news as far as nursing being able to respond to that call of action.
Yes, it was, sir. The actions of the nurses impacted us significantly, but the team, acting as one family, rallied together. And what we were able to do, we were able to bring in additional nurses who work flexi. We were able to have some of our administrators coming to relieve some of the persons who would be in charge, so that we'll have more staff in accident and emergency. I think that the staff must be commended highly for the actions they took to ensure that patient care was in nowhere compromised. The shifts continued well. We were able to continue our admission processes. We were able to continue triaging. And as Shane said, at the end of the period, I had very few patients left to be attended to. So that was indeed a success story in many ways, out of what could have been a very calamitous situation. So we commend the staff for their action. And as you've heard, we will continue to work with the unions to get a resolution to this COVID hazard allowance. We are hoping that we will be able to solve all the problems related to this issue in the very near future, and that there wouldn't be any repeat of such an action. But in all, we want to let the staff know and the public know that we are concerned for our staff, and whenever any member of our family has a challenge, every member has a challenge. So we are willing to work with the staff, work with the union to bring resolution to issues like these.
And it's all about working together.
It's all about teamwork. It's all about working together, but I think most importantly is also that we have contingency plans in place. And upon being aware of the situation, we went into that mode. That means that recruited in additional staff. That meant that some staff that were already on duty extended their working hours just to make sure that they had sufficient hands on board to take care of our patients. So the team effort rises above any of these events. And I must say, as a professional nurse by my career, that I was truly a bit disappointed in terms of these actions. And above all, as part of the leadership team, it becomes my responsibility and the others' responsibility to make sure that at no point we put our patients at risk. And this is why contingency plans, this is why continuous business plans are important. The continuity of business doing unplanned events.
Indeed. Remember, you can call us on this Pulse Radio show, the 4th edition in Season 2. Those numbers to call, 4341007, 4341070. And you can also send in your WhatsApps at 4341007. We welcome all calls, and we are here to help. That's what the Queen Elizabeth Hospital is about. I think we have a caller on the line already. Good morning, caller. We're going to get into the strategy in a few moments. Good morning. How are you doing?
Yes, hi. Good morning. How are you doing? I'm blessed, thanks. How are you doing?
We're well. We're well.
Glad to hear that, Shane. Well, good morning, COO. Sorry, my favorite.
Good morning. How are you?
Yes. Well, I'm humble, real, and kind of you can take 2 of these, and I'll call you next week, Monday. Love, joy, and peace.
I'll tell you this, though.
Yes.
Last time the COO wasn't here, you got in like halfway down the show.
Yes,
You heard that the COO is back,
Yes.
and the first caller we have is you.
Well, you know, she makes me feel better in terms of my faith, in terms of my smell, in terms of my color. And what am I talking about today, Shane? I'm talking about the aspect of having a healing nurse. I'm having a aromatherapy nurse and a color therapy nurse.
Yes.
We've made great, and I myself was just a nursing student, and I want to be a greater nurse now. So with all the advances that we've been making in nursing, from nurse aide as I was basically am to when I finished my training, to a nursing practitioner,
Wonderful.
an advanced nurse who is able to care for the needs of that only really a doctor can do. I think that we could finish it off really by having the aspect of a faith healing nurse, a nurse who is trained to faith heal, a nurse who is trained to be a healing nurse, which is a method of treating patients by prayer and exercise by faith, and trusting God on the aspects of health, on the tenets of health that we know. There's also the aromatherapy and the color therapy. The aromatherapy that you can use the stuff like marijuana, not the marijuana itself, just the smell of it, to be able to help your well-being and to help you to feel better. And as well as the color therapy. You just mentioned that you didn't know the color, Shane, so we could get you with one of those color therapy nurses to start you out so that you're able to indeed identify the right color and identify the fact that you've been healed, touched by an angel of the CEO of this hospital. It is important that we're able to be touched by the nurses, and she is one of the finest nurses that Barbados has ever produced. I want to thank you, Shane. You can comment on those things that I just mentioned, and I have one question here for the Mr.
Pinder.
Mr.
Pinder.
Yes, good morning. How are you, sir?
I am well. Good morning.
Yes, good morning. My question will have to be, now we've brought in many nurses from Ghana, and I was treated by some of the nurses from Ghana there recently. We thank them for that. We brought in nurses for the COVID for
Cuba.
Cuba, thank you. And my question is, how can we be able with bringing in these aspects, with bringing in the color therapy, the aromatherapy, the spiritual therapy, the faith healing, to be able to get Barbadian manufactured nurses? What can we do to level up and power up nurses from right here in Barbados? We have so many nurses from overseas here already, and they're doing a fantastic job. But what can we do to up the ante, to up the multi of the Barbadian nurse, and get the nurses manufactured from right here in BIM's finest? Thank you very much.
Thank you very much for your question. Mr. Pinder, you want to deal with that first? I know the COO will definitely have something to say, especially as far as building our nursing fraternity. And let me just say that Barbados Nurses Association has been doing a good job collaboratively with us in trying to pinpoint some areas where we can make some advancements. But Mr. Pinder?
I want to thank the caller for the question. The number of nurses that we need exceeds the number that we are able to produce in Barbados. Our flow comes from the Barbados Community College, and nurses we were able to. But in order to have nurses qualified, they must be able to pass the examination. So what we've been having is we've not been having a complete number of passes. And then on the other end, we're having resignations. We have attrition to where people are going to other countries. Persons are moving to other professions. We have had a couple of deaths. So there's an imbalance between the supply and the demand. We have done this for about 6 years, and there has been always a deficit. So to close the deficit, we have tried to increase the number of nurses being trained at the Barbados Community College. That has not worked to our benefit, in that we have not still been able to recruit, to train and recruit the number of nurses we need for that. Besides the Queen Elizabeth Hospital, we have the geriatric hospital, the psychiatric hospital, and a public health system that we also need to supply with nurses. So the numbers that are being produced, in a sense, by Barbados Community College are insufficient to fill the void. So we would need to have other training institutions, or we will need to rely on other types of training modules to increase the number of persons. So I think Barbados Community College is giving thought to part-time training for those who are working and would still like to pursue a career in nursing. That will bring an additional number. And we are contemplating looking outside of Barbados to have some of our training need met by other institutions from other countries, so that we could send some of our nurses to another country to receive their training, and when they finish at the end of the 4-year period, they will come back to us. But caller, we must be aware that it takes 4 years to produce a registered nurse. And along the way, sometimes people have other challenges that they would not be able to continue the program. So again, these are areas which creates deficit, but we are trying our best to look at measures that would increase the number of nurses on the ground, and recruiting from other countries has been one of the tools that we have used, the methods to close this gap. until the Barbados Community College can deliver an increased number, we will be always having a deficit. But we are hoping that with the reintroduction of the program and the renewal of the program there, that we should see increased numbers. For the last 2 years or so, we have seen an increase in the pass rate. So that means that more nurses are available to the hospital to fill those voids that would come upon us.
That's definitely some good news. Before you add to that, COO, we do have another caller. I know we have to still, get into some of those areas that he was calling for.
Yes.
Good morning, caller. Welcome to the Pulse Radio Show on Q100.7 FM. How can we help?
Yes, good morning to you, sir.
Good
Am I
morning.
on?
Yes, you are on. You're on.
Yes, good morning to you and good morning to the rest of your distinguished team. Very quickly, I really want to thank from the bottom of my heart. Sometimes saying thank you, sometimes that is not, you wish that you could do or say something even far much greater. But I want to thank the Queen Elizabeth Hospital for a job well done, sir, because I used to suffer with I think this is prostrate, and when you have the swollen testicles, and then you know what I mean, sir.
Yes.
Yes, we got
Right.
it.
We do.
Right, the testicles became swollen almost like a football, and the thing is, what we're looking at is that when you see like 2 o'clock, 1 o'clock in the night, even that start to hurt you, it could last for hours and hours and hours. And I mean, I had an operation at the QEH, and I have been relieved of that day, and I feel I must say thanks very, very, very much to all of those surgeons and doctors and even the team, the other team, the nurses that was around there in the surgery. And I am much relieved now, and I must say that I must give the hospital thanks. And I was even saying that when I get a chance, a few things, like a little alcohol, whatever I must bring and offer as a gift to the Queen. I don't know if that will be accepted. But
Well, not necessarily the alcohol. Probably some nice flowers or something like that. What I actually have a question for you.
Yes,
What was
sir.
your experience in terms of the nurses and them, treating you while you were hospitalized with us?
Well, sir, let me tell you something, and this is from the heart. I found that the nurses, the doctors, extraordinary, man. Those people, I have to say that they can't be from this earth. They will have to be from heaven, because I was treated very nicely. And you know what I noticed about the nurses? Sometimes even when you're sleeping, they come and check on you, and sometimes when you catch yourself, it is a nurse or whatever, whoever looking after you and your interests. And those people, man, I must say, I am lost for words, sir. But to answer your question, extraordinary, excellent, well done. I think they did. Nothing to complain about.
Well,
Nothing to complain about.
I want to assure you and the members of the public that we are committed to providing high quality, safe patient care to every member. And in a day, we have thousands of encounters.
Yes, sir.
But not everyone comes back and say thank you. So we want to commend you for saying thank you. And we wish that there will be more persons who will come by and say thank you.
Yes, sir.
There are thousands of positive experiences that go on in a day at the hospital, and we need to chronicle them. We need persons to come back and say like you, thank you. And
Yes,
not
sir.
only say thank you by words, but by your gestures. And I'm sure that if you talk to our philanthropy department, we can find ways by which your contribution can be added to the pool, however small, however large, to make the services better.
Yes, sir.
Thank you.
Yes,
Stay
man,
well.
I want to thank the whole staff. And quickly, before I go, I even was saying that the QEH, everybody should have a framed picture of the QEH in their house, because that is an institution that it is, I rather say it is one of the number one institution in Barbados, leading. Anything else could come second, but for me, sir, the Greenidge River Hospital comes first. It stands out. Number one. Thank you all very much.
And thank you. And stay well.
Yeah, thank you very much.
We have another caller on the line. Welcome to the Pulse Radio Show. What's your question or comment? Good to have you on.
Good morning.
Good morning.
To the staff. I was very shocked to hear the chief of the nursing officer said.
Director of Nursing, Mr.
Director
Pinder.
of Nurses said that he had to. They're thinking about having nurses trained overseas. I think I felt very hurt about that, because I was trained here in Barbados, and unfortunately, I see that we're not getting the results that we want. But the way I think about it, we have a police academy, we have a Coast Guard academy, we have a teaching academy, cosmetology academy, we have a university, we have medical universities also, and we have nursing was one of the universities in the years gone by where 2 sets of nurses were trained every year, July and January. And we always had a turnover maybe of 30 nurses per group. That has gone down the drain. We also train nurses from St. Lucia, St. Vincent, Tortola, all over the Caribbean, right here in Barbados. And I do think that it was but time that we have a nursing academy again. Take nursing out of what's the place? Community college, and it is very important. We need nurses. I don't see why we have to get nurses from overseas. We have nurses. We have children coming out of school, 4th and 5th form. Majority of them can't be university students. But if there is a nursing program within the 4th and 5th form where they come out as nurses' aides, and they go up the grade, they are placed in the hospital to do their practical and stuff like that,
their
maybe 1
internships.
day a week. And then that is an alternative of them getting them to go through the nursing program when it becomes available, if we have the academy. I can't see Barbados doing that when we did so well in years gone by. We had a tertiary school of nursing. What hurts my heart is I always have the picture of the whole old hospital from Bay Street up to Martindale's Road is being our new hospital. But I don't know if that will ever come to being in my time. But I do see that the hospital now would become, all the geriatric hospitals can be placed under that complex. It is a place where everybody can get to, and then from there we can go from there. There's a lot that can be done. I cannot see us bringing nurses from overseas, sending our nurses overseas to be trained. What is that? Come on, let's face it.
Caller, the COO definitely will respond to you, but I'll say this because I've heard, and I'm good friends with some of the SNOs, and people might say my favorite one is SNO Scott. And I know recently she would have gone on a training sojourn to Canada. There are some specialist areas that some other countries provide some of the best training, and we want our local nurses to get some of the best training so that not only that they can serve the public when they return, but they can train their fellow nurses as well. So they become trainers of trainers. So centers of excellence develop within the QEH and further afield. So I don't think you should exclude the idea of nurses going abroad to enhance their learning.
I'm not saying that you don't send nurses overseas to get
experience. Yeah, I think she's
I'm not talking about nurses. I'm talking about the fundamental. Let's face it. Come on, you can't send them for training before they get experience.
Yeah,
you're going to send a junior nurse to get experience in operating room technique, dialysis or what. No. They have to have like 3 years of the training where they get that, not training, but practice. Practice. You have to have practice. Before I leave this country, I had practice, and I could walk into any operating room and work. But you're gonna tell me that you're gonna send your nurses from PTS to train overseas? Oh, I understood wrong. I think we can do the PTS training here where nurses do their 3 years as a degree, and basically let them have that practice here and then send them overseas. And then there's a limited amount of nurses that you can send. If you're going to take your nurses from here, giving care to your patients, and send them overseas, and then they're going to come back in 2 years and leave and go to another country and work because they want more money. I mean, we all want money. I agree with that. But come on, let's face it. And this is what's happening. You bring nurses from Africa. They come here for 2 years, and they go to England. They take our ID and go wherever all over the world. Come on, let's get it, Barbados. Let's get it. Let's
the DNS, or Director of Medical Services, has a response for you.
Thank you.
All right, so
of nursing services. My apologies, Mr. Pinder.
So, as I said, it takes 4 years to produce a nurse. As it is right now, we do have gaps, and some of those gaps are about we're looking at 60 to 100 nurses. We need to fill those gaps in terms of spaces. So BCC is only able, because of their limited capacity also, in terms of tutors, in terms of clinical instructors, in terms of lab space, in terms of the facilities that they have, and the ability to have persons to be with the students when they are in the clinical areas. So we need, although we will continue to do our training here and increase the number of persons that we are training, we also need to have measures that for the next 3 years or so will close the gap until we can receive the number of nurses that will be ideally from the Barbados Community College to stop the drain that we're having. Now, yes, when persons go to BCC, we will be bonding them so that they will be spending some time in Barbados for the service that they have. But as you would be aware, nursing is like gold throughout the whole world, and so persons from all over the world recognize Barbados as a good practice area, recognize the level of training that our nurses have, the skills and the competencies that they possess, and they will come after them, and especially those that are experienced nurses. That's the group that they go after. And in many instances, we're not able to compete with the salaries. We're not able to compete with the offers that are given to them. And so persons will go after the monies. Not every nurse will go after money, but that seems to be one of the pulling factors for many of our nurses. Yeah. We will continue to explore other possibilities. We have the University of the West Indies, but I can't speak for the education authorities at this time. But we will have to seek to explore other training opportunities to increase the number of nurses that we have on the ground.
If I may add, caller, I think that first of all, thank you so much for your insight. And I just want to say that I am a nurse myself by profession, and I think we have to get very basic. We need to start at the elementary school levels.
Thank you.
We need to introduce nursing as a viable professional career for young boys and young girls, and start to nurture them into healthcare. And I'm not just going to advocate for my profession of nursing. I want to say also that there are dozens of other healthcare careers that we can begin to introduce to our young girls and boys. Not everyone is going to be a doctor. Not everyone is going to be a lawyer. But who takes care of lawyers and doctors and any other profession? The nurse. The healthcare sector is a very viable, sustainable career opportunities for young people. And somehow nursing needs to get out there. I'm going to challenge my Barbados Registered Nurses Association, the CNO, to start to rebuild the image
of what
Thank
professional
you.
nursing is all about.
Thank
We
you.
care for the public 24 hours a day, 7 days a week, with extended hours that we dedicate to the wellness and the well-being of people. So I'm going to advocate, yes, the academies that you cited, you're absolutely right, but I want to get into class 2 and 3 and 4 and
Thank
start
you.
to talk to people about what nursing is all about. And you know what? And the flexibility that the career offer as well. And just to say that from a global perspective, nursing, Mr. Pinder, we refer to it as nursing is gold. We are challenged as a profession throughout the world in terms of the aging of the profession. The average age now for nurses is approaching 50 years old. So that is considered, something to be concerned about in terms of the future of who will take care of me and others that are aging towards that perspective. So yes, you're right. And I think that the image needs to start with these young 7, 8, 9-year-olds and tell them what nursing is all about. We can do a better job in terms of the public image of what we do.
Yes, because I'm thinking that in nursing you have your nursing practitioners, your operating nurse, anesthesia nurse, emergency room nurse, home care nurse, instructor, directors, dialysis. I mean, there's so many opportunities. And I
Yes.
think if we get into the schools and get the kids, everyone's not going to be interested in nursing.
Yes.
I'll be honest with you, I wasn't interested in nursing either. But it's a beautiful profession. I love it. It's been all my life. But the thing about it is we have to start early. And that's not what we're doing. And then there is a culture that also comes in nursing that I just do not like. I don't hate to say it, but I would not say it. But there is a culture where our nurses, some of our nurses, because of money, yes, but there's an empathy in nursing that goes with nursing.
It's
There
called
is
caring.
empathy,
It's
caring.
called caring. You cannot do this job
You just cannot do it without that caring
without that
spirit.
caring aspect. And I'm
know?
going to hone in on that. And the day that any nurse or any healthcare provider gets to the point where they do not care about human suffering, they do not care about giving someone that trajectory in terms of hope and taking care of themselves, if they do not care about a dignified death, if you do not care, period, you have reached a point where you need to exit the profession, whether it's nursing, whether it's being a physician, whether it's being a pharmacist, but you have to have caring at the core of what you do.
And the other thing is to training. I'll be honest with you, we're going to open 3 more operating rooms. Within the time that you're getting ready to open those rooms, you can train 6 nursing technicians, 6 operating room technicians. RNs don't have to be scrub nurses anymore. That is out of the picture. You
Correct.
don't have to have an RN to scrub. You
Correct.
can use technicians.
Oh, our techs, yes.
And basically, the technician, because the RA is in charge of our operating room, if somebody codes in there, an aide cannot do a code. And this has been a system, I don't know if it has changed, but from the time I was there, that was it. And then I realized I went overseas and said, oh, Lord, what are we doing? Because the aide cannot do a code in the operating room. And so RNs need to be eliminated from being scrubbing. You need to train technicians, train in the ethics of nursing and let them know the ethics of it, and train technicians to be ready for that 3 operating rooms that you're getting ready for.
You're quite right, ma'am.
Yeah.
And these are areas that we have been exploring over the last couple of years. We will continue that drive, and we are hoping that we can have those technicians introduced into the system as soon as possible.
Yes.
Thank you.
Listen to me, and I hope I was of some sort of I would say my contribution helped in the way that some things can be changed.
Your contribution was definitely
Definitely.
welcome.
Definitely
Yes,
thought-provoking.
absolutely. And I think that there's something that since I came here, Shane, and Mr. Pinder will be aware as well, that we have dozens of individuals who went to nursing schools, and because of their situation in terms of being unable to now secure that registered nurse licensure because they have not passed the exam within X number of attempts. Typically 3. We're now looking at expanding up to a 4th time. So we have dozens of folks who went to nursing school, have a baccalaureate degree in nursing, and they're unable to be that nurse. And I think there's opportunity. I've had some conversation with the Barbados registered nurses. I hope that it has reached the thoughts of CNO that we can now look at this group. And I'm sure it's about 60 plus. When I came 2 years ago, that was the number I heard. And they can be, there's a second tier in professional nursing around the world. For example, I'm from New York, and we have what we call licensed practical nurses. They're not registered nurses, right? But they can do fundamentally about 85% of what a registered nurse do. They can give medication. They can document. They can do treatments. They cannot assess, but they'll work directly under the registered nurse. But this group of licensed practical nurses can be fundamentally staff your geriatric hospitals, help out in the polyclinics, help out in public health. And therefore, the RN, with the acute care level that we need of nursing within the hospital, would be much more leveraged or able to take care of a larger number of patients. So there are things that we need to look at. Trinidad did something very similar with this second tier level of nurse, the vocational nurse, the licensed practical nurse, and just had them licensed within that country. And therefore, we don't have nurses with a baccalaureate degree out there pumping gas or doing something unrelated to healthcare. There's opportunities, and we need to just change the mindset in terms of the scope of what professional and technical nursing is all about.
And you'll hear about the opportunities that fall under the 2025 to 2028 strategy for the Queen Elizabeth Hospital as we get into that very soon. Let's take one more call before we go to the break and then come back full on with the strategy. Good morning, caller. Welcome to the Pulse Radio Show. What's your question or comment?
Good morning, Mrs. Seeley.
Good morning.
No, I'm calling here about the nurses and the eye clinic.
Okay.
No, I was in the hospital earlier this year on C6, and then in July I had some very nice nurses, both outpatient, dressing department, and on the ward. But what I'm calling about is I have to get another operation on my left eye. I find that when I go to the clinic upstairs, whenever I go, don't care what time, don't care what day, they can never find my note. Never Sunday I get there 7:45, I went all up in 3 o'clock and 3:30. I still up there saying that they can't find the notes. Now I got to go tomorrow.
So you want to make sure that they find your notes?
I have to make sure to find out. I get an operation on the cataract on the right eye, and they say they have a swelling in the back, so they just have to give me injections in the eye before I get the left one operated. But I mean, it's frustrating.
It could be, but I can give you a simple solution or a number of options that you can have this addressed to make sure, one, that we start looking for your notes early, and two, that when you get there, you get the service that you come for. You know the number that I repeat every week, 536-4800?
Yes, please.
536-4800.
Yes,
you
please.
Call that number and explain to our medical team your situation so that we can start investigating. Also, I will ask you to leave your name with the producer when you go off. Don't run off, don't put down. You'll speak to the producer, leave your name and your contact details.
Yes, please.
So that we can look into the matter and make sure that we have you sorted.
Okay.
Yeah.
Thank you.
Shane, I want to emphasize that when we get concerns raised by this caller, that immediately when we ask for the background information, I will go back and get our public relations officer, namely Miss Williams, involved, and we will follow up to make sure that whatever the issue is resolved. Yes,
our patient relations officer will have that dealt with for you. So you don't need to worry.
Shane, I think we take this moment to say something positive too.
Okay, go ahead.
I want to give assurance to the caller that very soon your complaint is one that we will never hear. With the introduction of our hospital information system, your notes would always be available. You would know your appointments beforehand. You will be able to call in and check your appointment and make sure they're there. You'll be able to call in and dial in and see your own notes. So there will be no missing notes or lost notes when you turn up at the clinic. They will be always in the system, and every time you come, they will be available promptly. So we are hoping, and that's one of the reasons why we're pushing to have this hospital information system implemented. It will alleviate a lot of the problems that you and many other persons are facing. We're not saying that it should happen. It should not happen, but yes, it does happen, and we are hoping with the introduction of the hospital information system that these problems will be a thing of the past. So for all those other persons, please bear with us. We are hoping to have that system in as soon as possible, maybe early next year, and I'm sure that these complaints will be a thing of the past.
I hope that answers your question, caller. We'll take a quick break and come back with more, because that is a part of the 2025 to 2028 strategy, and you'll hear what the COO and the Directorate of Nursing will be doing under our new strategy. More in a moment.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
You're back with us on the Pulse Radio Show, a production of the Queen Elizabeth Hospital in collaboration with the Caribbean Broadcasting Corporation. I'm Shane Seeley, Communications Specialist with the QEH, alongside my co-host, the Chief Operations Officer, Dr. Christine Greenidge, and our Director of Nursing Services, Mr. Henderson Pinder. And the CEO is responsible for a big chunk of this 2025 to 2028 strategy. There's that service delivery component, which is about service delivery and team commitment. Of course, a number of these things also fall under the CEO, but right under the Chief Operations Officer, who is dedicated to enhancing clinical service delivery through strategic initiatives aimed at reducing wait times. That's a big concern for the public. Improving our patient experience, that is already happening, and you hear some of our callers singing the praises of our nursing staff, or our doctors and our ancillary staff. We are also trying to optimize clinical services as well. So all of these things the COO is responsible for overseeing, especially as far as the quality of care across the hospital.
Quality of care is something that every department is must strive for, and that is to ensure that the services that are rendered to the Barbadian public and to others who utilize our hospital is at its optimum functioning. And when it's not, it gives us the opportunity to look prospectively in terms of what we can do better. That is an everyday strife. There are metrics associated with quality of care. There are outcomes expected when you do the right things, that your patient outcomes should be at a level where we expect and or exceed the expectations of our patients. And I know that DMS was on a couple of weeks ago in terms of describing the medical services and the clinical component. You mentioned reduction in wait time, but also we want to make sure that the current clinical services that we have are at the level where they meet the expectations of our patients. And for those services that we don't have, how we can grow new clinical services and get to that part where we become, what I will say, branded for the services that we do and deliver consistently. And so the medical services strategies were shared by Mr. Anthony Harris, and today Mr. Henderson Pinder, who is the Director of Nursing Services, will share a little bit more about where nursing, the trajectory in terms of where the profession of nursing is going.
And it's so wonderful that you speak about the branding of the quality of care, because we've received an associated branding already through the accreditation that we've received, Accreditation Canada, and our gold certification, that gold seal of approval for the quality of care, and we have raised the bar on that in terms of meeting the standards under that gold accreditation.
Yes.
Looking into the Directorate of Nursing Services, the Director of Nursing Services is committed to delivering high quality patient-centered care that aligns with the QEH's strategic plan, and this role emphasizes fostering a culture of continuous improvement, enhancing the quality of patient care, and strengthening the nursing workforce. So this is a lot, and we see a lot of these pieces of the puzzle coming together as we welcome more nurses to the hospital, as we welcome more staff generally to meet the demand which is coming from the public. Speak about your responsibility, Mr. Pinder, in enacting this 2025 to 2028 strategy, at least your section of it.
Well, patient care is paramount to the operations of the hospital. And although we are dealing from a nursing point of view, I want to assure you that every member of the team has an integral part to play. But however, nurses are the ones who are most with the patients and have the greater impact upon the services that are offered from the hospital. And therefore, we want to make sure that our services are delivered promptly, they are empathetic in their delivery with the patient, that they are sympathetic, they're professional, and that they are based in care. Earlier we said that once you forget how to care, you really forget how to be a good nurse. And therefore we want to make sure that our nurses are careful. We want to have a model that is, we said, is family centered. So we want to have the family, the significant other, whoever you want to name as your person we want to have communicated with, we want to have that.
And that would be the next of kin.
It could be next of kin, or it could be proxy, however you want to call it, but that person identified. We also want to make sure that when we talk about care, we want to make sure that the care is offered dignified way, it's respectful, that it is happening. And we talked about communication, but communication, we have to have communication often. We have to communicate with the patient, we have to communicate with the team, we have to communicate, and that communication must be effective. So effective communication, again, is one of the tenets of offering good care. Now, what we are hoping to do is to offer that good care holistically, because we don't just deal with the body, we deal with the mind, we deal with the soul of the individual.
Just like one of our callers
was mentioning earlier, that we need to have a special emphasis on spirituality of the individual. And again, we might not see it that way, but a lot of persons have faith, and we do not quite yet understand the correlation between a person's faith, healing, and what we deliver as care in the institution. And once all three can come together, it tends to work well for the well-being and total well-being of the patient. You've also talked about our standards. We are ensuring that the care that they deliver meets specific standards. And we are presently with the Accreditation Canada is our accrediting body, and we have met these criteria for gold, but we want to raise the bar and go higher. We want to go for diamond very soon, and this would mean that our care meets international standard throughout the world, that persons can come from anywhere of the world and expect the same care that they will get in that part of the world. And that's why we're looking in each encounter to exceed where possible and surpass the expectations of our patients. Now, to do this, we have to have certain pathways for a patient. We need to be able to look at the patient and see how they're going to go through the system. And so we're working with the medical team to refine our pathways and make sure that each patient has a pathway. We have pathways in place now for heart attacks and stroke, but we want to go down further, pneumonias, fractures and everything, so that we know that when a patient comes in, we'll be talking to them from the beginning, communicated to them and their family, well, your stay in hospital will be 6 days. And we will work along each day to make sure that each aspect of the care that we're talking about is being implemented, so that by day number 6 we can begin we all along we're talking about discharge, getting you ready to come back, but by day number 6 you are confident with the care and you're ready to take home your relative. And that's a plan that we need to.
Right.
And these things, we said, are being measured against international standards. So we have KPIs that we've built in, key performance indicators that we've built in for each aspect. So we will be able to monitor what we're doing. We'll be able to look at the what is happening with our patients, the wait times, falls, the cutis ulcers, measure them and benchmark them against international practices to see how better we are able to deliver the care that we want to give to our patients.
I think a big part of the care delivery, the caring aspect of nursing, is to be able to integrate what we know exists, and that is evidence-based practice, research that has been done at the bedside with nurses and patients, and then professional nurses knowing that with evidence-based practice that is integrated into what they do on a 24-hour basis, that means that we have key performance indicators in place, as Mr. Pinder just mentioned, but also making sure that we evaluate and continuously evaluate the interventions that we put in place to be able to get to an expected outcome of quality for patients. I think another important aspect of the caring is for us now to look at these advanced nurse practice roles. A couple of weeks ago, yes, I'm so proud of this, with the intervention of our Minister of Health, Dr. Jerome Walcott, and along with the Barbados nurse and the CNO, that we now have this category known as advanced nurse practitioners. Right? Advanced nurse practice. Within the category, we have nurse practitioners. We'll have clinical nurse specialists. And importantly, with the nurse practitioner, who now can prescribe and treat under the jurisdiction and the cooperation with medical practitioners, that they can now be assigned a caseload of patients and manage a caseload of patients, or by disease entity or just in general. They have geriatric nurse practitioners. You have as well as medical surgical nurse practitioners. So they exist in every realm of what professional nursing practice is all about. But what an opportunity to really change the whole scope and the autonomy of nurses in terms of these advanced practice roles.
Indeed.
Yes.
Additionally,
before you go on, Mr. Pinder, we can't forget the callers there on the line waiting. Good morning, caller. Welcome to the Pulse Radio Show. What's your question or comment?
A blessed good morning to you.
Good morning.
Okay, I had two little points, but
Go ahead.
the first was just to say that I think I would have said it over this radio. I'm not sure if it was your program or the regular program, but I had reasons to be at the hospital. I admitted to the hospital on the 8th of August, and I had exceptional service from B5.
Salute B5, and thank you for the kudos.
Right, and then I went over to the dressing department, and exceptionally good service.
Appreciate
But
it.
my little point I want to make is that I think sometimes we, as patients, visitors, get frustrated and confused for lack of understanding. So I am so glad for this program. I say that to say, like, sometimes you see a nurse passing and busy, but because we don't clearly understand the function, we think, well, a nurse is a nurse and he or she can do anything. You understand what I'm saying?
Mm-hmm.
Not realizing that that person, based on what would have come out of this program, is not specialized in what we want. You understand what I'm saying?
Understand totally.
Right, so therefore we think she's a nurse and she can do, but that's not her department. Because when I was at the hospital, when I went for the surgery, I was there sitting and started to get a little frustrated. So I saw a nurse coming in and out, and when I actually said, no, I'm working with the eye clinic.
Yeah.
I'm working with the eye patients. I'm not in that department. Even though it was one door going in and out, I don't know if you know, I guess you would know the service situated. So sometimes it's just that we don't understand. So I think this program is a very good program, enlightening and educating us about the function of nurses. And at the same time, I would have met, he's a Ghanaian nurse that was in the recovery.
Right.
And I think I see him as the mayor of that department. because everybody was looking. If I may call his name, he was Lambert, and everybody was Lambert this and Lambert. They was looking up to Lambert for the function in that department, and I think he did for the little time that I was there in the recovery room before he was transferred to the ordinary ward. I think he did a good job.
Thank you.
So
Thank you for sharing
keep
that.
up the good work. Everybody would not be in favor, but at the end of the day, I always say this is the only hospital we have, and we have to depend on the nurses and the doctors. So I wish them all the best, where you can educate them, where they can be educated, where they can be involve them, and I hope that they will see it while they're getting paid for it as a job, that they will see it for the love of patient. With that being said, have a blessed day.
Thank you very much.
Notice
You
I
too.
said earlier that we will continue to communicate. I think, as you said, communication is a very important tool that we need to use in the hospital. We will continue to communicate. We will communicate often. We will communicate as much as possible. And with Shane on board, helping us with the communication strategy, I think we could only get better.
Yeah.
But what we also want to do too is share, because when things happen or when we have experiences, we want to share those learning experiences around the hospital so that everyone can learn from the experiences and improve the practices as we go along, because we all function for one goal, and that is to give patient care. Excellent, safe patient care. And that's what we are here for every time.
Indeed.
And to do that, just one more point, we need to really do some continuous education. So for our nurses, we are striving to make sure wherever possible that there is continuing education available for them, so that they can refine their practices, they can improve the care that they offer, they can have greater competencies, they can be able to exceed the expectation of the public. And one of them we want to work on is customer care and improving that patient care experience.
Agreed. And you will see it unravel all under this 2025 to 2028 strategy, being led by the CEO, Neil Clark, and of course operationalized by our Chief Operations Officer, Dr. Christine Greenidge, who I met one of your friends yesterday, Dr. Greenidge, and they were asking me about you. A gentleman called, I think he's Henderson too. He's Henderson. And he was asking me about Dr. Greenidge and I know you were supposed to be staying with us till December, and you're back with us now. But I hear that you may be staying with us a bit longer.
Indeed. I want to be very truthful and transparent.
As you always are.
Yes, I resigned on September 30th with a date of December 14th of this year. And recently I took a 2-week vacation, and I rethought my decision to do that. And when I came here to my birth country in February 2022, I came with the desire, with the passion to give back my skills, my knowledge to my people. I came to battle for better health care. I came to battle to really narrow that gap of communication between healthcare providers and the public. And I realized that my tenure of 2.5 years, that there's a lot more left to be done. And with that refocusing, I have rescinded my recent resignation, and I'm looking forward to working with Neil and the wonderful executive team at the hospital towards that trajectory of better services, of more timely services. Looking forward to the arrival of a linear accelerator to help treatments with our oncology patients. Looking forward to this new migration into technology by the incorporation of electronic medical records, where Mr. Pinder described having access to a patient's medical record, but most importantly for patients to have access to their own individual medical record and histories. And so I rescinded. I am back with vigor. I am back with total commitment and effecting care. And also this show, you know, that we kind of birthed this idea of sharing with the Barbadian public and providing communication and a much more accessible means of them being able to maintain healthier states as well. So yes, I have rescinded, and I'm looking forward to the continuation of very important work from my heart to my Barbadian people.
So I'll summarize that by saying she's saying that she could not leave me to do this Pulse Radio show by myself because she is my co-host. The Pulse Radio show is her baby. I'm just the executor, and I really want to say it has been my pleasure, and it will continue to be my pleasure to work alongside you, COO, and the rest of the team. Of course, our CEO, Neil Clark, leads us into what is a new way of thinking and a new modus operandi for the Queen Elizabeth Hospital, and it is focused on you, our patients, the public, and we will try as best as we can to meet your demands at the QEH. That's it for this edition of the Pulse Radio Show. A lot in it. We will continue next week with another element of the 2025 to 2028 strategy, letting you know how it caters to better patient care, better outcomes, and a better QEH for the people of Barbados. I'm Shane Seeley, and on behalf of Mr. Pinder, our Director of Nursing Services, and our Chief Operations Officer, Dr. Christine Greenidge, I'd like to say you be safe, and we'll see you next week.
The Pulse Radio Show was brought to you with the compliments of MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.